All right. Well, thank you for having me back. It's great to be, back with you. I think I'm the last talk, right? So, all right. We'll wrap it up quickly. We'll make it easy and quick. So, all right. Let's get started. I brought a fun case for you to kind of see. These are my learning objectives. But the case was an actual case that came to our practice. Here's a 60-year-old gentleman who travels quite a bit. He's an executive. He is on some meds for hypertension, hyperlipidemia, and he get a leg cramp. So he called his personal physician, who orders, correctly a lower extremity venous ultrasound. And sure enough, that showed non-compressibility in the popliteal veins, and you can see actually the clot there in the popliteal vein there. So would you, he had no respiratory symptoms. He only had some leg cramps. Would you get a CT of the chest to see if he had a pulmonary embolism associated with this DVT? And this was in the popliteal. So we know the higher the clot in the leg, the more likely that they are associated with, some pieces in the lung. So would you get sorry, is this formatted or not? All right. Thank you, David. All right. Of course not, but remember, he's an executive. He had a personal physician, so he gets a CT of the chest. And sure enough, 25% of the popliteal clots are associated with a pulmonary embolism. And if you look here, there is actually a clear, subsegmental PE. Very good answer. So, he's an executive. It is in his 50s. He has some vascular disease. Would you get a thrombophilia panel on this gentleman? Obviously, clearly it was provoked by traveling. And remember, he's an executive, so I don't want to have to that to you. Remember that, Dr. Demenkov, when you... All right. So you're correct. He get a thrombophilia panel. And sure enough, he had a factor V Leiden, So, he has the most common thrombophilia that's known. And factor V Leiden is associated with with increased risk of deep vein thrombosis, not pulmonary embolisms. So the physician start him on Eliquis, on apixaban, 10 milligram twice a day for a week, and then followed by 5 milligram twice a day. And that's the recommended treatment for an acute venous thrombosis. Would you check this gentleman for